group of hospitals 8 years back. 8 years back, and our first patient was none other than Gayatri here, and she herself knew that she was the first patient for our hospital. Yeah, and the first patient to enter inside the BMT program. She came with lot of challenges in life. First thing was, I had promised her when she started with the disease that it was an immensely curable disease without transplant. Even with just oral medicines, you can survive for many years. And unfortunately, she progressed into an aggressive phase of the disease, and that is when we decided that we need to salvage her with transplant. And we did a mass sibling allotransplant. Now she is here in front of us without any medicines, almost like 7 to 8 years now, without any complications. She continues to do all her activities with the same vigor as what she used to do before she got the transplant. I would welcome Gayatri to share a few words, maybe for a minute. Thank you.
So ನನ್ನ ಹೆಸರು ಗಾಯತ್ರಿ ಅಂತ. From 2017 ನಾನು ಟ್ರೇಸರ್ ಆಯಿತು ಬ್ಲಡ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಅಂದ್ಬಿಟ್ಟು. ಅವಾಗಿಂದ ನನಗೆ ಮಹೇಶ್ ಮತ್ತು ಸುನೀಲ್ ಮತ್ತು ಆನಂದ್ ಅವರು ತುಂಬ ಕೇರ್ ಆಗಿ ಟ್ರೀಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. 2019 ಲಾಸ್ಟ್ ಆಯಿತು, ಲಾಸ್ಟ್ ಟ್ರೈಸಿಸ್ ಅಂದ್ಬಿಟ್ಟು 2019 ನಿಮಗೆ ಬೋನ್ ಮ್ಯಾರೋ ಮಾಡಿದ್ದಾರೆ. ಅವಾಗಿಂದ ನಾನು ತುಂಬ ಖುಷಿಯಾಗಿ ಲೈಫ್ ಲೀಡ್ ಮಾಡ್ತೀನಿ. ನೋ ಪ್ರಾಬ್ಲಮ್. ಮೊದಲು ಹೇಗಿದ್ದೀನೋ ಹಾಗೇ ಇದ್ದೀನಿ. ಅವ್ರ ಮೂವರ್ಗೂ ನಾನು ತುಂಬ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತೀನಿ ಸರ್. ಅವ್ರ ಮೂವರು ಅಷ್ಟು ನನ್ನ ಕೇರ್ ಆಗಿ ಒಬ್ಬ ಫ್ರೆಂಡ್ ಆಗಿ ನನಗೆ ಟ್ರೀಟ್ ಮಾಡಿ ತುಂಬ ಕೇರ್ ಮಾಡಿಕೊಡ್ತಿದ್ದಾರೆ. ಈಗ ಅಷ್ಟು ಖುಷಿಯಾಗಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ ಯು.
One perianal abscess. His white cell count was very low, and when we did a bone marrow aspiration biopsy, we had to again give bad news for him that he was suffering from acute myeloid leukemia. And he's again one of the first for Sparsh group of hospitals. We did a first matched unrelated donor transplant for Vijay. He had 7 siblings, but none of them were a match. And now here he is in front of us. Again, he is not on any medicines. He takes care of his 2 children, and most of them are doing well. He has been educating them quite well, and he has again joined a job and he is doing an amazing job in his field.
ಹಲೋ ಸರ್, ನನ್ನ ಹೆಸರು ವಿಜಯ್ ಕುಮಾರ್ ಅಂತ. ನಾನು ಬಂದು ಗುಲ್ಬರ್ಗದವನು. ನಾನು ಫಸ್ಟು ಮಹೇಶ್ ಡಾಕ್ಟರ್ಗಿಂತ ಫಸ್ಟ್ ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಗೆ ನಾನು ಚಿರಋಣಿಯಾಗಿರ್ತೀನಿ. ಯಾಕಂದರೆ ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಯಿಂದಲೇ ನಾನು ಮಹೇಶ್ ಡಾಕ್ಟರ್ ಪರಿಚಯ ಆದರು. ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಗೋಸ್ಕರ ನನಗೆ ತುಂಬ ಸಹಾಯ ಮಾಡಿದ್ದಾರೆ. ಮತ್ತು ತಿರ್ಗಾ ನಾನು ಹೇಳಬೇಕಂದ್ರೆ ಸುಮಾರು ಇದೆ ಸರ್. ನಾನು ಮಾತಾಡೋಷ್ಟು ನಿಮಗೆ ಟೈಮ್ ಆಗಿಬಿಡುತ್ತೆ. ಯಾಕಂದರೆ ನನಗೆ ನನ್ನ ತಂದೆ ತಾಯಿಗಿಂತ ಮತ್ತು ನನಗೆ ಫ್ಯಾಮಿಲಿ ಸಪೋರ್ಟ್ನೂ ಇರಲಿಲ್ಲ. ನನಗೆ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಟೈಮಲ್ಲಿ ನನಗೆ ಶೆಲ್ಸ್ನೂ ಸಿಕ್ಕಲ್ಲ. ಟೈಮಲ್ಲಿ ನಾನು ಹತ್ಬಿಡ್ತಾ ಇದ್ದೆ ದಿವಸ. ಸರ್ ನನಗೆ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡೋರು ಸಿಗಲಿಲ್ಲ. ಮತ್ತು ತಿರ್ಗಾ ಸರ್ ಹೇಳಿದ್ರು, ಇಲ್ಲ ನೀವು ಏನು ಧೈರ್ಯ ಪಡಬೇಡಿ, ನಾವು ಇದ್ದೀವಿ ನಿಮ್ಮ ಜೊತೆಗೆ ಅಂತ. ಆ ಥರ ಒಂದು ಧೈರ್ಯ ಕೊಟ್ಟರು. ಆ ಧೈರ್ಯದಿಂದಲೇ ನಾನು ಇವತ್ತಿನ ದಿವಸ ನಿಮ್ಮ ಎದುರುಗಡೆ ಇದ್ದೀನಿ ಸರ್. ಮೇನ್ ಅದು ಇದೆ. ಆಮೇಲೆ ಅದರಲ್ಲಿ ನನಗೆ ಕೋವಿಡ್ 2 ಟೈಮ್ ಆಯಿತು ಅದೇ ಹಾಸ್ಪಿಟ್ಲಲ್ಲೇ. ತಿರ್ಗಾ ಆ ಟೈಮಲ್ಲೂ ಸರು ಮತ್ತೆಲ್ಲ ನನಗೆ ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟರು. ನಿನಗೇನೂ ಆಗಲ್ಲ, ನೀನು ಚೆನ್ನಾಗಿ ಆಗ್ತೀಯಾ ಅಂತ. ಆನಂದ್ ಸರು, ಸುನೀಲ್ ಸರು, ಮಹೇಶ್ ಸರು ಎಲ್ಲ, ಮತ್ತು ಇನ್ನೊಬ್ರು ಮೇಡಮ್ ಇದ್ದರು, ಅವರು ನನಗೆ ತುಂಬ ಸಹಕಾರ ಕೊಟ್ಟಿದ್ದಾರೆ ಸರ್. ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ನಾನು ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಗೆ ಈ ಫೌಂಡರ್ ಯಾರಿದ್ದಾರೆ ಅವರಿಗೆ ನಾನು ಬಹಳ ಧನ್ಯವಾದ ಹೇಳ್ತೀನಿ. ಆಮೇಲೆ ಇದ್ದಿರೋಂಥ ಡಾಕ್ಟರ್ಸ್ಗೆ ಮತ್ತು ಸಿಸ್ಟರ್ಸ್ಗೆ, ಅಲ್ಲಿರೋಂಥ ಎಲ್ಲ ಸ್ಟಾಫಿಗೆ ನಾನು ಇವತ್ತಿನ ಗಂಟ ಚಿರಋಣಿಯಾಗಿರ್ತೀನಿ. ನಾನು ಯಾಕಂತಂದರೆ ಮಹೇಶ್ ಡಾಕ್ಟರ್ ಅವರು ನನಗೆ ಇನ್ನೊಂದು ಜನ್ಮ ಕೊಟ್ಟಿದ್ದಾರಂತ ನಾನು ನಂಬ್ತೀನಿ. ಯಾಕಂತಂದರೆ ನಾನು ಹೈ ರಿಸ್ಕ್ AML ಪೇಷಂಟ್ ಆಗಿದ್ದ. ನನಗೆ ಅವಾಗ ಡೋನರ್ನು ಯಾರೂ ಸಿಕ್ಕಿರಲಿಲ್ಲ. ಆಮೇಲೆ ಅವರೇ ಎಲ್ಲ ನನಗೆ ಒಳ್ಳೆ ರೀತಿ ಎಲ್ಲ ಮಾಡಿಕೊಟ್ರು. ಪ್ರತಿ ಒಂದು ದಿವಸನೂ ನಮ್ಮ ಮಕ್ಳ ಬಗ್ಗೆ ವಿಚಾರಿಸ್ತಾ ಇದ್ರು, ನಿಮ್ಮ ಮಕ್ಳು ಏನು ಮಾಡ್ತಾರೆ ಅಂದರೆ. ಈ ಥರ ಇರಲಿಲ್ಲ. ಡಾಕ್ಟರ್ ಅಂತಂದರೆ ಬಂದರು, ನೋಡಿದ್ರು, ಹೋದ್ರು, ಆ ಥರ ಇರಲಿಲ್ಲ. ಅಂದರೆ ಈಸೆಲ್ಲ ನಮಗೆ ಏನಂತಂದರೆ ಒಂದು ಫ್ಯಾಮಿಲಿ ಥರ ನೋಡ್ತಾ ಇದ್ರು. ಮಕ್ಳು ಓದ್ತಾ ಇದ್ದಾರ, ಏನು ಮಾಡ್ತಾರ, ಚೆನ್ನಾಗಿ ನೀವು ಆಗ್ತೀರಾ ಅಂತ. ಮತ್ತು ನಮ್ಮ ಮಕ್ಳಿಗೆ ಬಂದಾಗ್ಲೂ ಅವ್ರು ಧೈರ್ಯ ಹೇಳ್ತಾರೆ. ಯಾಕಂದರೆ ನಮ್ಮ ವೈಫು ತೀರೋದ್ಮೇಲೆ ನನಗೆ ಯಾರೂ ಸಪೋರ್ಟ್ ಆಗಿರಲಿಲ್ಲ. ನಮ್ಮ ಮಕ್ಕಳು ಆಸ್ಪತ್ರೆಗೆ ಬಂದಾಗ ಸರ್ ಹೇಳ್ತಾಯಿದ್ರು, ನಿಮ್ಮ ಪಾಪ ಚೆನ್ನಾಗಿ ಆಗ್ತಾರ, ನೀವೇನು ಭಯ ಬಿಡಬೇಡಿ, ನಾವು ಚೆನ್ನಾಗಿ ಮಾಡ್ತೀವಿ ಅಂತ. ಆ ಒಂದು ಧೈರ್ಯ ಮೇಲೆ ನಾನು ಇವತ್ತಿನ ದಿವಸ ಬದುಕಿದ್ದೀನಿ ಸರ್. ಅದಕ್ಕೆ ನಾನು ಮಹೇಶ್ ಸರ್ ಇರೋ ಗಂಟ ನಾನು ಅವರಿಗೆ ಮತ್ತು ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಗೆ ಚಿರಋಣಿಯಾಗಿರ್ತೀನಿ ಅಂತ ನಾನು 2 ಮಾತು ಮುಗಿಸ್ತೀನಿ ಸರ್. ಧನ್ಯವಾದಗಳು ಸರ್.
More Sparsh Institute of Cancer Care in our other units which are spread across the town. Our RR Nagar unit is going to get the complete comprehensive cancer care. So is our Sarjapur Road unit, and more in the pipeline. We want people to travel less and get the same expertise everywhere. We are trying to geo-map the city of Bangalore and be there for everybody to give the best possible cancer care. And it is an extraordinary grace for us that the name which is identified with cancer care, not just in Bangalore, across our country. Dr. Shekhar Patil is our biggest well-wisher, he's our director, and he is an epitome of ethical practice, because cancer is such an area where people will do anything to save their lives. And what's very important is how ethically we practice this medicine, how empathetically we practice this medicine, and how we can make these extraordinary possibilities available for most people at an appropriate cost and the way it has to be done, so that they're put through least amount of difficulty. And there's no better human being, there's no better mascot for Sparsh than Dr. Shekhar Patil. We are very, very blessed to have his guidance, his directions, in which we are doing everything we do in cancer care. And that's the biggest gain for Sparsh Hospital in the last few years of his association with us. And that's all I have to say. And I wish the entire team the very best of luck.
Being increased. And second is, it is a lifestyle disease because of our habits, the type of food we eat. We are becoming more and more westernized. So because of that one, the incidence is also increasing. So what I feel is the infrastructure and the number of doctors treating this disease is definitely much, much less than what we require at this point of time. So that is how, when I came with Dr. Sharan, he was having general comprehensive general hospital. I requested him that no, you should have an oncology wing for every hospitals you have it, because because of the number of patients are increasing. People have to travel very, very long distance to get that care. So that is how it started, and I can only say that we have got the best comprehensive setup. All the infrastructure, radiation oncology unit, medical oncology unit. What was efficient was the bone marrow transplant unit, and everything, and the nuclear medicine, theranostics, palliative care, almost, and verticals, particularly the subspecialties in oncology itself, like orthopedics oncology, thoracic oncology. We have got specialists for each cancers. So the type of care, the patients are going to get will be really, really great, basically because of the expertise what we are going to have it. So what I feel is, now with the BMT coming in, at least 15-20% of our cancer patients at some point of their treatment requires the transplant treatment. Maybe in the
easy to say, there's nothing left to say after what Dr. Sharan and Dr. Shekhar have said. Obviously, oncology is evolving, and for us, access is a big thing. And all our hospitals are located in such a way that the micro markets, the larger population can access our hospitals much easier. And hence, it made all the logical sense to have a very important specialty like oncology here. And with the launch of BMT, the entire scope of services within that specialty is now complete within this hospital, which makes the hospital also responsible for ensuring treatment which is transparent and also full of empathy, because oncology needs long-term hand-holding and within clinicians and the support staff. Very proud to ensure that we've got everybody in place who will deliver this care, and also very happy and thankful to the patients who've undergone treatment under this team to be here, and also as a testament the fact that the clinician team that we have here is world class, and through the media friends we want to convey that anybody who needs top class treatment doesn't need to go anywhere else. Institute of Cancer Care is the answer. So please help us send the message across, and all the best to the team. Wishing the entire the Sparsh Hindu team all the best and very happy to share this news. Thank you.
ಅಷ್ಟು ಕ್ಯಾನ್ಸರ್ ಅದ್ರ ಬಗ್ಗೆ ಅಷ್ಟು ಅವೇರ್ನೆಸ್ಸೇ ಇರಲಿಲ್ಲ. ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಭಯ ಇರ್ತಿತ್ತು, ಹೇಗಪ್ಪ ಅದ್ರ ಟ್ರೀಟ್ಮೆಂಟ್ ಆ ಥರ ಎಲ್ಲ. ಸೊ ನಾವಿದ್ದಿದ್ದು ಮೈಸೂರಿಂದ ಬ್ಯಾಂಗ್ಳೂರ್ ಬಂದಾಗ ಮೈಸೂರಿಂದನೂ ಮಹೇಶ್ ಸರ್ ಹೆಸರು ಹೇಳ್ಕೊಂಡೆ ನಾವು ಬೆಂಗಳೂರಿಗೆ ಬಂದಿದ್ದು. ಸೊ ಮಹೇಶ್ ಸರ್ ಸಿಕ್ಕದ ಮೇಲೆ ಒಂದು ಹೋಪ್ ಅಂತ ಬಂದಿದ್ದು ಲೈಫಲ್ಲಿ. ಓಕೆ, ಇರುವಂದಾಗುತ್ತೆ, ಒಳ್ಳೇದಾಗುತ್ತೆ ಅಂತ ಅನ್ಕೊಂಡು. ಸೊ ಆ ಹೋಪೇ ನಮ್ಮನ್ನ ಇಲ್ಲಿವರೆಗೂ ಕರ್ಕೊಂಡು ಬಂದಿದೆ. ಆ್ಯಂಡ್ ಲೈಫಲ್ಲಿ ಟಿಲ್ ಲಾಸ್ಟ್ ಬ್ರೆತ್ ನನ್ನ ಗ್ರಾಟಿಟ್ಯೂಡ್ ಯಾವಾಗಲೂ ಮಹೇಶ್ ಸರ್, ಆನಂದ್ ಸರ್ ಆ್ಯಂಡ್ ಸುನೀಲ್ ಸರ್, ಪೂರ್ಣಿಮಾ ಮ್ಯಾಮ್ ಆ್ಯಂಡ್ ಹೋಲ್ ಟೀಮ್ ನನ್ಗೆ ಯಾರು BMT ಮಾಡುವಾಗ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರು ಅವರಿಗೆ ಖಂಡಿತವಾಗ್ಲೂ ನನ್ನ ಗ್ರಾಟಿಟ್ಯೂಡ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಆ್ಯಂಡ್ ನನಗೆ ಡಯಾಗ್ನೋಸ್ ಆದಾಗ ಕಂಪ್ಲೀಟ್ಲಿ ಡಿಪೆಂಡೆನ್ಸಿ, ಏನೊಂದಕ್ಕೂ ಡಿಪೆಂಡೆನ್ಸಿ ಆ ಥರ ಇರ್ತಿತ್ತು. ನನಗೆ ಗೊತ್ತಿಲ್ಲದ ಶಕ್ತಿಗಳನ್ನ ಸರ್ ನಿನ್ಗಿದೆ, ನೀನು ಸ್ಟ್ರಾಂಗ್ ಇದೆಯಾ, ಆ ಮೋಟಿವೇಶನ್ ಯಾವತ್ತೂ ಮರೆಯಕ್ಕಾಗಲ್ಲ. ಅಂಡ್ ಆ ಮೋಟಿವೇಶನ್ ಇವತ್ತಿಗೂ ನನ್ನ ಮುಂದೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದೆ. ಅಂಡ್ ನಾನು ಇಂಡಿಪೆಂಡೆಂಟ್ ಲೈಫ್ ಲೀಡ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ಹ್ಯಾಪಿ ಆಗಿದ್ದೀನಿ. ಇವಾಗ ನಾನು ಏನೇ ಖುಷಿಯಾಗಿದ್ದೀನಿ, ನನ್ನ ಇಂಡಿಪೆಂಡೆಂಟ್ ಲೈಫ್ ಇದೆ ಅಂತಂದ್ರೆ ಆಲ್ವೇಸ್ ಐ ಥ್ಯಾಂಕ್ ಟು ಸರ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
Dear friends, myself Sapna Anta. I'm basically from Dhanwad, sir. So in 22, multiple myeloma agide anta I was diagnosed. Their swarupa, Shivan swarupa antaralla, nam bhava ee Shivan hatra nan kalisitru. So by God grace, nam Mahesh doctor, nam Anand sir, Sunil sir, so ಇವರ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಇಂದ ಇವತ್ತು ನಾನು ಇಲ್ಲಿ ಕೂತಿದ್ದೀನಿ ಅಂದ್ರೆ ಬಿಕಾಸ್ ಆಫ್ ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಸರ್. ಸೊ ಆಕ್ಚುಲಿ ಐ ವಾಸ್ ಇದೇನಪ್ಪ ಹಿಂಗಾಯ್ತು ಅಂತ ಕಂಪ್ಲೀಟ್ಲಿ ಏನು ಮೈಂಡೇ ಬ್ಲಾಂಕ್ ಆಗ್ಬಿಟ್ಟಿತ್ತು, ಏನು ಓಡ್ತಿರ್ಲಿಲ್ಲ. ಇಟ್ ವಾಸ್ ದ ಮಹೇಶ್ ಸರ್ ಅಂಡ್ ದ ಟೀಮ್, ದೇ ಯೂಸ್ ಟು ಬೂಸ್ಟ್ ಮೀ ಈಚ್ ಅಂಡ್ ಎವ್ರಿ ಡೇ ಅಂಡ್ ಎವ್ರಿ ಮೂಮೆಂಟ್. ಅಂಡ್ ಒನ್ ಥಿಂಗ್ ದೇ ಹ್ಯಾಡ್ ಟೋಲ್ಡ್ ಮೀ, ಅಕ್ಸೆಪ್ಟ್ ಇಟ್. ಹೌದಲ್ಲ, ಐ ಹ್ಯಾವ್ ಟು ಅಕ್ಸೆಪ್ಟ್ ಇಟ್. ವಾಟ್ ಹ್ಯಾಸ್ ಕಮ್, ಐ ಹ್ಯಾವ್ ಟು ಅಕ್ಸೆಪ್ಟ್ ಇಟ್ ಅಂಡ್ ಲೆಟ್ ಮೀ ಗೋ. ವಾಟ್ ಎವರ್ ಇಟ್ ಕಮ್ಸ್, ಲೆಟ್ ಮೀ ಗೋ, ಲೆಟ್ ಮೀ ಫೇಸ್. ಸೊ ಯಾವಾಗ ಬಂದ್ರು ಒಂದು ಸ್ಮೈಲಿಂಗ್ ಫೇಸ್ ಅಲ್ಲಿ, ಇಲ್ಲಮ್ಮ ನೀನ್ ಚೆನ್ನಾಗಾಗ್ತೀಯ, ಡೋಂಟ್ ವರಿ. ಅದು ಒಂದು ಏನಿದೆ ಅಲ್ಲ, ಈಗಲೂ ಕೂಡ it is securing me. So the really heartfelt gratitude to the entire Mahesh sir and the team, and I thank you a lot. Thank you sir, thank you for everything sir.
I request Mrs. Sapna to come on.
Good morning. Hello.
As an hospital, expanding as well.
Yes.
How many more centers?
Well, that will be conversation for another day.
Okay. So besides medical treatment, what extra service does this branch offer help the family manage
So there are three.
long-term illness in terms of financial, as you mentioned?
So there are three verticals in cancer care which become very important. First is preventive. So we are very keen that we do a lot of work in preventive care. First, the best thing is to prevent. Not everything is preventable, but whatever is preventable or early detection is a massive area which we are focusing on. There's going to be a complete vertical which we are establishing. Second is, of course, curative. When it happens, then we need to cure it. So that's the second vertical which is the core of what activity happens in the hospital. And there's one more vertical which is called the palliative. Sometimes we don't win the battle, and we just need to give the dignity in facing this whole situation. So we are doing palliative care at this moment itself, but we are expanding that to a massive center near the airport, and that will happen in the next maybe about 18 to 24 months. There we will be doing a lot of palliative care. There is dignity in life and death, both need to be there. So we are working in that direction. To support these verticals, we also have a foundation called the Sparsh Foundation. So there are a lot of good people around who are very happy to help us to reach out and give that financial support through the foundation. So the foundation has got its own leadership. The foundation is growing by the day.
Most frequently.
Orthopedic surgeon can't answer that.
So for bone marrow transplant, if you're talking the blood disorders, the major is that we classify into benign disorders and the malignant disorders. Benign disorders is thalassemia major, aplastic anemia, sickle cell anemia, and some immunodeficiency disorders. And the malignant conditions like acute leukemia, lymphoma, multiple myeloma, they all get the bone marrow transplant. So if you're asking us which blood disorders we treat in Sparsh, so all the blood disorders are treated in Sparsh Hospital. So we have a team of 5 hematologists, and anything related to blood problems we will be treating in our institute.
What are the current success rates?
So current success rate again depends on the kind of disease which we are treating and the kind of transplants which we are doing. As you can see here in front of your eyes, there are 4 patients, all different diseases, and all are doing well. Almost like 8 years now, they have been doing well and they are virtually cured of the disease. Some diseases are immensely curable, like thalassemias, aplastic anemias to a core of 90%. But sometimes blood cancers, even if we do transplant, the cure rates will be somewhere in the range of 40 to 60%.
Doctor, how affordable are
the patients who are not cured by medicines or surgery? Most of the patients lose hope when they reach to an extent of transplant. Patients should always be hopeful because a cure rate with transplant is enormous, especially for some of the benign disorders. There is always a hope of cure when we do transplant, and with the same hope, we take the patients for the transplants.
Some extent your address, basically what stands Sparsh Institute Cancer Care, the BMT here will be what I feel is the support system, the other departments, because there is a attached general hospital which can give a cardiology, because the patient on bone marrow transplant can get into any complication, neurological problems, cardiac problems, any infection, respiratory problems, all support system is excellent. That is what I feel stands different from the other transplant units.
It's important for the general cancer care also. When you hear a word of cancer, they already lost the battle. That's what the patient always think. So nowadays, with a lot of targeted therapies and immunotherapies, we have moving towards the chemotherapy-free regimens. So there is a very, very good hope for majority of the cancers. So nowadays, we tell the patients like, you just take a pill and you will be cured. Even if the patient hear the word of cancer, we tell them every day you have to take a pill and you will be okay like a normal person. So that science has moved so much forward that most of the cancers can be cured with new treatments.
Dr. Sharan sir, what is your any expandable this one is there?
No, I like Dr. Shekhar Patel said, we have to be, as a healthcare entrepreneur, somebody who's building healthcare organizations and trying to contribute to our national health, our focus has to be on what is the need of our society and the community. That's where we have to be, and we have to do that. And we strongly at Sparsh feel cancer treatment of the highest quality. There's cancer treatment and there is cancer treatment, something which has become so curative. If it is not being provided for lack of expertise or infrastructure or affordability, it is a crime. So we need to be there in this field in a very, very aggressive manner. That's why Sparsh's big attention has turned towards cancer. And we want to be really the people who are relevant to the society needs, and that's why we are here. And this is going to be our mission. Every new unit we start, even in our existing units, the expertise to treat cancer is a big emphasis. We believe 30% of the work, or even we talk about anywhere between 30 to 40% of the work will be cancer.